Good afternoon, and a very happy new year to you and to your families. Can I just start by just apologising, actually, for the slight delay? We had some technical issues at the very beginning. But I also want to say thank you to all islanders for your continued commitment, cooperation, and for the vital changes you made to your Christmas and New Year plans in order to keep the most vulnerable in our community safe from Covid-19. So the extended circuit breaker that we implemented through a series of measures in November and December 2020 is working to date. Test positivity and case rates have dropped, and over the last 7 days, the average number of new cases per day has fallen to 21. Today, the number of new Covid-19 cases recorded was 16, and the total number of active cases in our island is now 302. That is a drop of 628 cases across the last 2 weeks as a direct result of the steps we've taken together as a community. And because of that, we can look forward to the coming months of 2021 with some hope. Hope that we can and will see the end of restrictions that keep families and friends apart and businesses closed. Hope that we continue the effective and efficient rollout of our vaccination programme, immunising the most vulnerable in our community, and hope that we can allow islanders to resume normal lives as soon as possible in a safe, controlled and measured way. Jersey is vaccinating faster than most other countries globally, and we currently rank third in the world for the number of vaccinations per 100 people, behind only Israel and Bahrain. It is our determined aim to vaccinate every islander aged over 50, i.e. just under half the population, with at least one dose by the end of March, and to have vaccinated all eligible islanders by the start of September. Jersey also compares well with the UK, Ireland and other European countries in terms of the number of active cases and our case positivity rate, despite the spike in cases we saw in late December. Developing a winter strategy meant that we acted quickly and had a better test and trace programme in place when the second wave appeared, ensuring that we could accurately understand the spread of the virus in our community and how to react. Incoming passenger travel has remained low, and this will continue with the announcement earlier today that EasyJet has suspended its current spring schedule to Jersey, and BA has scaled theirs back to weekend flights only. Across November and December, 70% of travellers arriving the island were residents returning home, including students and school boarders returning to Jersey. Only 2% of the total arrivals were business visitors, and all of those were required to isolate under our guidance. I should also emphasise that during the ongoing UK lockdown, islanders should not be visiting the UK for any reason other than essential travel, which includes health and compassionate reasons, as this would break the UK guidance upon arrival. Now, local enforcement activity has also been critical to the good position we find ourselves in, and since April, the States of Jersey Police have visited 1,668 premises, given 1,888 words of advice, and closed 11 premises. 884 checks alone have been carried out since the 1st of December, and in total there have been 14 convictions for Covid-19 related offences, with £25,300 issued in fines and a 6-month suspended sentence given. And so these are the extremes of the negative behaviour we have seen by a very small number of people. But by contrast, the vast majority of islanders, including those arriving back through the ports, are working alongside law enforcement to help see our community safely through this period. And the police, environmental health and the monitoring and enforcement team will continue working with islanders to police the virus and to constantly reinforce that sense of civic duty to keep people safe. And as a result of the extensive progress in vaccination, testing, travel and enforcement, we are in a position where we can prioritise students returning to school from next week, supported by a bespoke testing programme, which includes weekly testing for teachers and pupils in years 11 to 13. Putting children first remains our top priority, and we need to give students the time to settle comfortably back into school and have the best possible protection in place for them. And this will include updated risk assessments taking place across nurseries, schools and colleges, improved contact tracing arrangements for schools, and all arrangements for pupils are being kept under regular review. This will be the first step in our gradual process to reconnect the economy and return islanders to normal life. But this must be done safely and step by step, giving the necessary time to assess the impact of relaxing measures on the spread of the virus. It will not be achieved by rushing, by becoming complacent, or by taking actions which risk our safety, our high-risk islanders, or our health services. And I want us to be in the strongest possible position as we take each step, so that islanders and businesses can return to normality with confidence, and then we can look forward to a year where we can gather, work, live and celebrate as a community once again. So I'm now going to ask the Minister for Health, Deputy Richard Renouf, to provide further details about our vaccination programme and the process we will follow to ensure a gradual and safe return to normality. Richard.
Thank you, Chief Minister, and good afternoon, everybody. I want to begin by echoing the Chief Minister's thanks to all islanders who have responded as a community to the new laws and guidance brought in just before Christmas. This has been key to the improved position we have now reached. But I need to be clear, this is not the end of our fight against the spread and impact of Covid-19 in Jersey. We are moving in the right direction, but we still have considerable distance to go. We need to continue to robustly suppress community transmission, especially given the potential rapid effect of the new Covid-19 variant. Although this has not yet been shown by laboratory tests to be present in Jersey, we need to assume it is already in our community, and we must act in an appropriately cautious way. So as a result, we will gradually implement the process of reconnection with sufficient time between stages to monitor the impact on new cases of Covid-19 and the positivity rate. This staggered and measured approach will allow the vaccination programme sufficient time to protect the most vulnerable in the community and shield them from any adverse impacts. 3,188 islanders have now received the first dose of the Pfizer vaccine, and 11% of those aged 80 or more have already been immunised. Yesterday, we opened registration for those aged over 80 in the community seeking the vaccine, and I'm delighted that over 2,000 islanders signed up for appointments, and more today. I'm immensely grateful to Dr. Muscat, Julian Blaisby, Becky Sherrington, Ross Barnes, and the entire vaccination team for their rapid, effective work to deploy the vaccine across our community. The vaccination programme will reach full operational capacity from the 18th of January, with the ability to vaccinate 7,500 islanders per week, but which is limited only by the amount of vaccine received from the United Kingdom. Staff in Health and Community Services are already reviewing their ability to surge that capacity if more vaccine is received, to ensure that we can complete the rollout of vaccine as quickly as we can. Yesterday, the competent authorities ministers endorsed the decision of the medical director to move to a 10-week period between 2 doses of the vaccine, as recommended by the MHRA, our regulator. Under this timeline, 49,000 islanders will have received their first dose by the 29th of March, including all high-risk islanders. By the 12th of July, all 105,000 islanders will have received their first dose of the vaccine, with the second dose completed by the 6th of September. This is a truly phenomenal effort and one that will provide robust protection across our entire community. As the Chief Minister has said, ministers have also agreed to introduce a staged process for reconnecting our economy and society. The first stage, which has been outlined, will involve the return of school pupils on Monday the 11th of January, with all necessary precautions and contact tracing in place. On Monday the 18th of January, STAC will meet again to consider the current medical position, the analysis of the Christmas period, and the early impact of reopening schools. They will advise whether it is appropriate, on the basis of the data available, to move to a second stage of reconnection. And this might include measures that present the lowest risk to an increase in case numbers and positivity. This could include non-essential retail opening, indoor recreation, and close contact services. These activities present a lower risk of transmission according to international and local data. They contribute positively to well-being, and they are associated with effective mitigations such as masks and 2-meter distancing and PPE. STAC will then present their recommendations to competent authority ministers on Wednesday the 20th of January. And if ministers are content, then any relaxation in measures could be announced on the next day, Thursday, 21st January, probably to take effect the next Monday, 25th of January. After that, further stages will be considered by STAC, and a similar process followed. There will always be at least a 2-week gap between any relaxation of each tranche of COVID measures, the purpose being to allow us to understand the impact that relaxation has on the spread of the virus. And this process will continue to be followed gradually and always guided by the latest case and vaccination data to allow economic and social reconnection, until the appropriate point, which will only occur when the key metrics from both case data and the vaccination programme show it is safe to do so. It's so important that islanders continue to respect the restrictions in place and not to mix households. In this way, by acting on the real case data we see and by moving through stages, we can assure islanders of the safest return to normality. So I thank you, and I'll now ask Dr. Muscat to set out the medical position and the trends we are currently seeing in the island.
Thank you, Minister, Chief Minister. We are in a better place now than we were in mid-December, with about 25 new cases on average per day instead of the 78 or so new cases per day that we were seeing before Christmas. Testing rates have come down. Over the festive period, as they have in many other countries, but the positivity rate has come down even further. There have been some 90 hospital COVID patients in the second wave, but currently there are significantly less than 5 COVID admissions in hospital, none of whom are in ITU. However, we must not believe we are home and dry. Our case rate remains at around 301 per 14 days per 100,000 population. And sadly, we have had some 21 COVID-associated deaths in this second wave. We have yet to see the effects of Christmas and New Year, but hopefully this will not be detrimental. Indeed, the feedback we have is that people have followed public health guidelines, and I seriously thank you for that, as do my colleagues. The rates in surrounding countries are very high indeed. And with the new variant in the United Kingdom and other countries, with a 70% increased transmissibility, but without increased virulence, and still covered by the current vaccine, is a threat. The second variant is the South African variant, which is similar, but may possibly better evade the vaccine. This latter remains to be seen, to be confirmed. On the other hand, we are now vaccinating our population at pace. And we are doing so in such a way as to protect as many at-risk people as possible, as soon as possible. So, given the delivery schedule of the vaccine, this means giving the first dose to all those over the age of 50 and those with underlying conditions to achieve a high level of protection as soon as possible, and then giving the second dose in about 10 to 12 weeks' time to increase the durability of that protection. And this, of course, is in keeping with the advice of the UK regulatory bodies. As the Minister was saying, Jersey is third in the world in terms of vaccine delivery. And the rates are gradually going up day by day. How do we put all this together, this good news and this bad news? It still means that we must be very careful moving forward to keep our numbers down through adherence to public health guidelines, through using our excellent test and track system to capacity, and to be extremely careful at our borders. It may be that the new variant is already here, the UK new variant is already here. We have no virological proof of this yet, but the viral activity suggests this. We do not want to introduce more, and we most certainly do not wish to introduce the South African variant. All these measures and our efforts will allow our vaccination program to progress and our schools to open successfully and stay open. And they will also allow greater but cautious freedoms and therefore better physical, mental and economic health. Thank you. I will now pass you back to the Chief Minister.
Thank you, Ivan and Richard. We are in a strong position as we enter 2021. And this is because we took the right decisions at the right time and worked together as a community to protect one another. Now, some have alleged that our winter strategy has not worked, but this is not borne out by the results we've seen to date. Now, although case rates were high over December, Jersey has been consistently testing and tracing more than 3 times as many cases as the UK, for example, and so is finding proportionately more positive cases. And since publication of the winter strategy in November, which anticipated increasing cases, more than 20 different policy measures were introduced in rapid succession, including gatherings orders, mask wearing, testing programs, increases in operational capacity, distancing, and the circuit breaker arrangements. And the outcome has been clear. Case rates are dropping, and we've not had to resort to the type of lockdown measures currently being implemented in the UK and other jurisdictions. So today, our adoption of the winter strategy has allowed us to set out the plan for the careful reduction of restrictive measures and the circuit break. And when making decisions about appropriate COVID measures, we are always looking for the right balance between safeguarding public health and enabling as much of normal life to continue as possible, bearing in mind the impact of restrictions on personal health, on job security, and on our economy. And we understand that the measures that are continuing for the coming weeks will continue to adversely impact many businesses, especially those in the hospitality sector. And ministers will continue to review the support available to adversely impacted sectors of the economy. And we also cannot ignore that there have been deaths as a result of COVID-19, and I extend my sincere sympathies and those of all my ministerial colleagues to those families who have lost loved ones during this period. Every loss to this virus is a tragedy, and our constant reminder to islanders of the real risk this disease poses. I'm also acutely aware of the pressure on island students during this uncertain and worrying time for them, but I want to say thank you to all of them. You've been an inspiration across the Christmas and New Year periods and have supported your families whilst keeping the community safe. We are now reopening schools, and there will be, understandably, stress for you and friends, and from the exam period you now face. But the Education Department, Youth Service and the entire community will do all we can to support you through this time. And I want to close by thanking all of those listening and our wider community. And it is you who allowed us to reach this position, and I must ask you to continue this effort a few weeks more. Until the restrictions on household mixing are lifted, do not visit one another's homes, but instead meet outside in a maximum group of 10. And I know this is difficult, especially in the cold weather we are experiencing, but it's essential to keep our highest risk islanders safe. Please keep up your good spirits and support each other through these last difficult days, and please also share with one another the hope for a better year ahead, and one where our island weathers the storm of the last year and moves forward with pride and purpose as a community. But thank you for listening. We'll now take questions from the media. Okay, so we have Islin Jones from ITV, Tom Innes from the JP, Fiona Potney from Bailiwick. I think we have Alex Watson from 103, but I think he's feeding the questions through to us, and with Julie Flanagan from the BBC in the room. So I think we'll just go in the order I've gone. So for the moment, we'll go for Islin on ITV.
Good afternoon, ministers and Dr. Muscat. First of all, considering household mixing is clearly one of the last stages of reconnection, social reconnection being the last stage, so to speak, considering the fact that it is all now tied in directly with the delivery of the vaccination programme, with those initial priority groups hopefully vaccinated by the 29th of March, should we all assume that that is the earliest that we can expect household mixing, normal social or more normal social interaction, should I say, to resume?
I think we must assume, Islin, that we will certainly have some restrictions beyond the 29th of March, but whether they will be precisely the same as we have now, it's difficult to say. We will look at the evidence stage by stage and consider what is the best thing to do. We do bear in mind very much that this isolation is harmful to many people in our community, and we don't want that harm to create that problem. So for those who do feel isolated and at risk, we want them to reach out and access the means of support that are available. But certainly we are beginning to think, and our experts are beginning to consider what the scenarios might be with greater numbers of people vaccinated in our community. And that thinking is beginning, not just in Jersey, but in the UK, and it has to happen throughout the world. We will be moving to a different way of managing this pandemic. Thank you.
Nothing to add, is there? Okay, second question.
Going on to education now and the reopening of schools. We obviously heard Boris Johnson earlier in the week describing schools as vectors for transmission. We've seen the Isle of Man also, with hardly any cases at all, closing schools. We clearly think that we are in a different position here. To anyone who still has concerns about sending their children back to school, any teachers, can you explain how we are different?
I'll do my very best, and then I'll hand over perhaps even to Ivan, perhaps to go through more. I think reason as you heard you asking that question, I don't know if the camera or the slide that I've got behind me can be just put up, or if I just pointed it. I'll point at it essentially. What I'm going to point at is where Jersey is and where the UK is. That's Jersey. This is the UK. We've gone down. UK has gone up. Now, I don't know if people see that. I'll try and explain that into English, as it were. So what I was saying is that the Jersey rate has always been below the UK significantly. And in the last few weeks, it's gone down to 1.6%. And I'll try and explain that in a sec. Whereas, and we didn't have the data on the comparable day for the UK, but the one before, the UK is at 10%. And that basically means that for every amount of testing we're doing, we're finding a 1% rate of positive cases, whereas the UK is finding 10%. I hope Ivan is nodding, so I hope I've got that right. Now, the point about that is as well, so whilst we've had large numbers of positive cases we've been identifying previously, and again, apologies for doing graphs, but sometimes it helps if we can actually get the slide to move, which it isn't. Now, I don't know, again, you can just look at this one. And again, I'll just point as to where we are in testing and where Jersey is in testing and where basically everybody else is. We're here. Everybody else, a bar, sort of a couple of countries, everybody else is down here. And what that means is that we are testing so many more, and even where in the dip, when we were testing 8,000 people a week in December, I think that's the Christmas period, versus the UK, again, the week before was about 4,000. So what we're doing is we're identifying a lot more people a lot earlier, and because we're identifying them as positive, they are then isolating. We're getting them early. They're not spreading the virus on the island, whereas elsewhere, people aren't detecting them, and therefore those people unwittingly are still spreading the virus around the community. So that's the other measure we're seeing. So we're testing a lot more, we're capturing a lot more people, and we're getting them early when they don't know they've got the virus, and we're telling them to stay home and not spread it. So those kind of factors are therefore saying why the risk here is different to the UK, and I'm really trying to keep this as simple as possible. And then on top of that, what we've also done, and I won't go into the detail, but there have been various extra measures that have been put in place within the schools. That's one of the reasons for delaying the opening until the 11th, was just to get them time to assess. And then on the advice of STAC, we're testing all the age groups of years 11, 12 and 13, which is happening this week, and all the staff. And then that's going to go to a weekly cycle using certain kits that we've been given from the UK, about 65,000 of them, which we're dedicating specifically to education to do on a weekly basis over the next few weeks. And then that will give us a lot more early warning again of any issues that start to develop. And the reason we're so focused on that is because very clearly, and again, Ivan, I'm sure will reiterate it a bit more eloquently than I will, is the sheer damage that does happen over long-term, if you like, life events and the ability to progress oneself forward in life. The damage that happens in access to educational services, if you like, to being taught, is significant, which is why the absolute advice under the present circumstances is to get the children, to get the pupils back into school and into learning. There are alternative measures in place if there need to be for exceptionally vulnerable people, but the fundamental one is about getting people back into school and learning. And obviously we're going to keep that under review on a very regular basis. Perhaps Ivan might want to comment more on the measures and the rationale behind what we're doing.
So thank you. So one of the more important measures is, as indicated by the Chief Minister, and that is weekly testing of all those in years 11, 12 and 13, supported by PCR testing before the start of term, at half term and at Easter. The testing will pick up the more infectious people, and therefore identify those who pose the greatest risk to their fellow pupils, and allow us to take appropriate measures. The schools have, over the months, refined further and further the safety measures they have put in place in the schools. The contact tracing team has refined its contact tracing systems to reduce the number of direct contacts that are identified in the form of large bubbles. They are focusing more on the perceptible direct contacts rather than a sort of blunderbuss direct contact approach to minimize the effect on education of children. So over the months, all the systems that were in place have just been improved upon again and again, and we feel we're in a much better position now to reopen schools on the 11th. And as part of that, we're testing this week in anticipation of opening next week. As the Chief Minister was saying, there is very clear evidence from around the world that keeping children away from school is harmful to them, not only directly and in the here and now, both in terms of education, general well-being, safeguarding and so on, but also in future years. And some of what's lost may not be redeemable. So we do want to put as much effort as we can into what is an essential part of our society, and that is education and schooling.
Okay. Tom, JP.
Good afternoon, Ministers. I hope you can hear me adequately.
Yes.
I sense there may be a reluctance to admit, to look back too far and admit to mistakes and not getting things 100% right, albeit during an unprecedented pandemic last year. But there does seem to be a change of tack very much here, going for a much more cautious approach and taking things very gently. It's the word elimination hasn't featured at all, but it does seem that there's a real determination to take things slowly and avoid another dip, or perhaps even, dare one say, a Guernsey-style approach. How would you respond to that?
No, I think you're putting words into our mouths there. What we're saying is that we took the measures we consider at the right time. We did respond pretty swiftly when the numbers changed direction, essentially, and put the measures in place that we needed to put in. And actually, as we were indicating pre-Christmas, the results we would have seen would have been around the 18th-ish of December. I think it was actually the 22nd that we saw the first dip. It's not a precise science in terms of saying it's exactly 14 days, but that was broadly speaking in the period. And then the numbers started coming down again in the right way. And I really emphasise the point we've said previously about the volume of testing that we're picking up and identifying people early. And that's kind of borne out by the other factors of it's also partially around making sure that hospital services aren't overwhelmed. And to date, that has not been the case. So going ahead, what we're saying, the reason we're urging what you might call a balance between a cautious approach and I would hope a pragmatic approach is we're not yet clear as definitively what the outcome has been from Christmas and New Year. In terms of the reporting we've not had huge issues identified to us. But again, we're just maintaining that caution until we get beyond those kind of 14 plus days of obviously Christmas, but particularly New Year. Now, obviously, 14th day for Christmas is tomorrow. Realistically, I think the earliest would be the beginning of next week. We'll actually see if there's been any upturn or not significantly. And then obviously the other one will be New Year, which will then follow realistically the following Monday-ish. So I think it's best just saying the reality is the concern was before Christmas of the gatherings and the impact that we might see. in the same way as we believe we saw an outcome that came from half term, and we want to see what those measures look like. So that's why we're saying we are being cautious, but it's being pragmatically cautious because we're not yet out of the 14-day periods of those two very significant events. After that, obviously, we can then assess as we've been going down, which is why we're trying to give the certainty and a direction of travel, looking forward over the next few weeks and few months, but also in conjunction with the fact that obviously the Oxford vaccine has now been announced and come online, as it were, in the last couple of weeks. So dealing with the changing circumstances of, I'd say, much more certainty. It's not absolute certainty, but much more certainty around delivery of supply of vaccines and then how we can deliver it out. Anybody want to add to that, Cesar?
I just briefly say, Tom, that yes, it is very definitely a cautious approach because we have transmission on Ireland and our strategy is to control the spread of transmission and achieve the balance of harms which best protects our community. Thank you.
Okay, second question.
I wanted to focus on travel. It's you mentioned the very low numbers of cases and the importance of maintaining tight borders. Are there going to be any additional measures in April, May, June last year? People had to apply for permission to leave the island. Now you seem to be leaving it up to their good judgment and telling them that they shouldn't because of the UK's restrictions.
Tom, sorry to interrupt. Can you just go slightly closer to the microphone because it's breaking up a lot more?
Yes, apologies. Looking at travel and contrasting the situation now with the situation in April, May, June last year, where islanders had to apply to leave the island for various reasons. Now you're leaving it up to their judgment as to the fact that they shouldn't travel. They'd be in breach of UK guidelines rather than imposing a Jersey restriction on their movement. So will that change, and will there be any other changes to border policy regarding length of isolation or other features for people arriving here?
Okay, in terms of only the medical side, obviously I hand over to Ivan, but as of today, there's no intention to change anything at this stage. I think we make the point that we acted again before Christmas to basically define everywhere in the UK as red, particularly when the announcements came through on the new variant. And so, and that remains unchanged. So essentially anybody coming into Jersey should be isolating for 10 days, and I believe it's tested on day 0, 5 and 10. And that remains the case. And to be honest, in terms of the foreseeable future of the next few weeks, I don't really see that changing unless we find something quite extraordinary happening somewhere else. And again, if the medical advice was to change to say we need to strengthen measures, we obviously would. But to date, we have got a strong border. And we have got a strong process in place, and equally it's backed up by law, which was the point we made in the opening speech, as it were, of identifying those people who have been fined or measures have been taken against them, and those are in force. Ivan, do you want to comment any further on the kind of the medical perspective at this stage?
It's certainly our intention to have as well a controlled border as possible. Bearing in mind what's happening outside Jersey, both numerically and in terms of variants. How this will change going forward is yet to be seen, but the immediate future is to manage all inbound travellers as red. Indeed, all people transiting through UK airports are also classified now as red, and to be just as careful as possible. And classifying them as red is, as the Chief Minister said, isolation till a negative day 10 swab, having had an arrival swab and one at day 5 as well, of course. The number of positive inbounds is very low at the moment because the number of travellers coming into the island is low, and so on average only about 3 positive inbounds are being noted per day in the latter couple of weeks.
You've talked about being as strong as possible, but there was a ban on people leaving the island in April, May and June, and now it's just a recommendation that you shouldn't. Is that as strong as possible?
I don't know if it was a ban. I think it was people were asking individuals to restrict themselves to essential travel and over and above travel for health reasons, which of course was always exempt from restriction.
And from memory, because at that point the main airlines weren't servicing the island, so I think it was only the Lifeline flights that were coming out through Blue Island. That was essentially the effective control that was in place. What we're saying at the moment, of course, is that the UK have got very, very strong restrictions anyway. And so the practical thing is going to be that there's not going to be very much travel happening because essentially you can't. You've got to follow the local guidance, and it's currently against UK rules. I'm just looking at some notes to visit other households except for very limited reasons. So getting over there in itself, or even landing there, is going to be difficult going forward as an individual. Okay. Oops. Fiona.
Thank you, Ministers and Dr. Muscat. It's clear that the quicker we roll out vaccines, the quicker we can open up the island's economic and social life. But you've just told us that it probably won't be until September that all eligible members of the population receive at least 1 dose. So with that in mind, can you explain why you've decided to have just 1 vaccination centre at the fort, and whether any consideration has been given to allowing GPs to administer vaccinations?
Okay, I'll do a couple of comments, then I'll hand over to everybody who's directly related to health. I think you've got to look on the positive side. The fact that we can actually say we hopefully have done just under 50% of the population by the end of March should be very, very, we should be really pleased and very proud that that's even in our sights. And don't lose sight of that. The limiting factor on this is the supply of the vaccine. It's not the willingness or the capacity to actually do the actual vaccination, if you like. It's the actual getting hold of the supply. So obviously that supply changes, then the plan changes as well. It has to. But I think you should be exceptionally positive. The fact that we as an island can have basically all vulnerable groups, which is basically categorised as slightly concerned to find out, and being one of them as being over 50, that they will all have had their first vaccination by the end of March. That's what, 10 weeks away, something along those lines? Mm-hmm. And that should be a fabulous story, because then that changes the whole dynamics of where we can be. And that's why we're saying there is light at the end of this tunnel. And as we said, if we go back up to that chart, which is going to be on the website at some point, sorry, going the other way. If people look at the top right-hand box, which is the other jurisdictions, we're third on that list. You look at some of the other very big countries, they're much, much lower down. Now, obviously, it's a small jurisdiction notionally, but obviously that is where actually the UK has done exceptionally well, because they've got exceptionally large orders out there for the vaccines, and we are part of that supply line. Now, in terms of the delivery of the vaccine, again, not my territory, but one of the big focuses has been to make sure that GPs can continue to deliver the primary care side, whilst we deal with the logistics, and there are quite significant ones, particularly when it was Pfizer and it had to be and continues to have to be stored at -70 and things like that, and dealing with the trays, because you can only take 1 tray out of the freezer at a time. As soon as it comes out, that all has to be used and not wasted, etc., etc. Therefore, there's quite a lot of quite specific logistics that tie into the delivery of this. But obviously, as things change, I suspect that process will change. But that's what we've had to deal with at the moment. And the game plan from memory is that by around the 18th, 20th of January, we can do up to, I think it's up to 1,000 people a day, or I think Richard was saying 7,000 odd a week. Right. Somebody can correct me on the basis I've gone straight out of Chief Minister territory into health territory, but there we go.
Well, I think I'd just say we must remember we're still in the middle of this pandemic, so our doctors are a key resource to address people's primary care needs. So it's important surgeries remain open for all the usual purposes. And we also have many GPs working in the vaccination team. I'm very grateful for them coming forward. And we've got to remember the huge logistical exercise that this is, 105,000 people to twice go through a place before September in order to receive their vaccinations. It needs space, it needs careful control and record keeping and the like, and the vaccination centre was deemed the most appropriate, as it is in many other places. We see that in the UK, where it's a sort of a dual delivery between vaccination centres and GP surgeries, bearing in mind GP surgeries are part of the NHS in the UK, so there is that centralised approach there. But I'll hand over for more detail to Dr. Muscat.
Thank you. The first thing to say, I think, is that we are receiving vaccine at exactly the same rate as the UK, but we receive it in proportion to the size of our population, which is distributed equally, if you like, across the UK populations. We are simply seen as part of that population, so we are not disadvantaged at all in that manner. And the delivery rate is about 4,500 vaccines per week. We have always pledged to ensure that the limiting factor would not be our ability to vaccinate, but the vaccine delivery schedule. So that, and our vaccine delivery, our vaccinator rate is about 7,500 per week, or will be after the 18th of January. So we are well prepared to deliver more vaccine than the 4,300 that we get per week, should it arrive. And it may do so as we go into quarter 2 and quarter 3 of this year, possibly even late quarter 1, with the arrival of vaccines besides AstraZeneca, Oxford, and Pfizer. So we are prepared to deliver more if that becomes available. The other thing that really is worth emphasizing is that the ambition is to provide as much protection as possible to as many people as possible, as soon as possible, in the at-risk groups, in the people over the age of 50 and those who have underlying conditions. And in order to do that, the actual schedule has been sensibly altered to allow us to achieve that. The most important protective dose from the vaccine is the first dose, and it provides between 73 and 88% of protection after about 3 weeks after vaccination, depending on whether it's Oxford or Pfizer. And that protection lasts for a number of weeks and allows then people to give one dose to many, many people. And then about 10 weeks later, you go in with your second dose to increase the durability of that vaccine. And when you're giving that second dose, if you can, you also give further first doses to now people under the age of 50. So that's the plan, and the plan is designed to combat the outbreak. It is not a routine immunization program. It is not a replica of some childhood immunization program which happens at a sort of sensible, regular pace. It is a program that is meant to deliver protection as soon as possible.
Okay, second question.
Thank you for that explanation. Your officials told Express on December 16th that the test samples had been sent off for sequencing to check if the new variant was already on the island. Can you explain what the delay has been in obtaining that information and when we will have it? As while we know that you are taking a cautious approach and acting as if it is still here, because there is so much unknown, to a degree we are still flying a bit blind. So can you tell us a bit more when we can expect that information and what the delay has been so far?
So we did send 10 samples off just before Christmas, and we've received the results back on 7 of those 10 samples. None of those 7 results indicate a new variant, but we believe that the sample size that we sent was small, too small to pick up new variant if it's here, and we are obviously sending off more samples, and we'll be sending off at least 10 new samples per week. The reason there was a delay in getting the results back was because we sent them over a festive period when work slows down a bit. And of course, at the same time, there is a huge backlog of viruses waiting to be sequenced. So we had to join the queue during a go-slow period, so to speak. But the results are back, and we will be sending regular examples of viral isolates on a weekly basis to keep an eye on what's going on.
Okay. Thanks very much. Just looking behind, do we have 103's questions?
Thank you. A question from Alex at 103. He says that we've had daily stats issued from the government for some time on case numbers. Will the government provide regular updates on vaccination numbers too?
Well, that's easy, actually. If you look at the screen behind us, that's the infographic that we're likely to be putting out on a, well, I don't know how often, but on a very periodic basis to keep everybody informed. And my understanding is that will go onto the website weekly. Okay.
Second question is, as the government plans to reconnect different parts of the circuit breaker, what are the likely timescales for each different aspect of returning to normality? That is, non-essential retail, hospitality, working from home, distancing, etc.
So at the moment, we are principally focused on getting through the next 2 weeks, which is, as I've said previously, around just assessing if there is any increase in numbers as a result of Christmas and New Year. And I said, this is not a scientific comment, it's just my expectations, is at the earliest we're likely to see any information on that will be kind of beginning of next week from Christmas, and also the week after that, probably for New Year. But we've allowed a few days in there just to continue on the cautious approach. Now, if the numbers go where we'd expect them, or where we'd like them to go, then I think it is the competent authorities, as we call them, the ministers, will meet on the 20th and will assess the results. And if the numbers are in the right place with all the other parameters that we're going to be taking into account, then there is an expectation, I think, that we should be able to release, for example, non-essential retail on that following Monday, and that will depend. But we're really emphasising the cautious bit here. The numbers have to be in the right place. If they're not, then obviously we'll need to wait longer. Now, if the numbers are in the right place, and also taking into account the other parameters that we're looking at, we're essentially then going to be looking at roughly every 14 days, doing a similar assessment. And if things are in the right places, then it is likely that we can start reversing some of the measures we put in place, and probably in roughly that sort of order. In other words, the first ones that were closed down will probably be the last ones released. And that's all about risk and risk of transmission and keeping that programme going. But that's also then, and sorry it's a slightly longer answer, it's also taking into account of how the vaccination programme is going and where we are in terms of the percentage of islanders that we've done. And I think at this stage, so we're just focused initially on these next 2 weeks. Let's get to the 2 weeks from Monday. Let's get to the 25th. We'll be assessing it in the middle of the week before, and then we can see where we go. Nothing to add, I think, from that side. So, okay, right. I think Julie, you've been waiting very patiently.
Chief Minister, we have seen bars, restaurants, hotels closed since the 4th of December. Realistically, it's going to be maybe the 4th of February before there's any chance of them reopening. So given that they've been out of action for 2 months, what is your message to these businesses that many of them are on the brink of collapse, and also those people who are worried they're not actually going to have a job to go back to when this is all over?
So we are acutely aware of the issues facing businesses. In fact, I was literally just before coming to this press conference, I was having a remote meeting or virtual meeting with Chamber and with Senator Farnham. And what we've said is, look, we are very clear that we keep the measures that we do to support businesses under review a lot, and we get a lot of feedback as well, as I'm sure you can imagine. And certainly, I can't speak for the Treasury Minister, who obviously looks after the purse strings very, very, very carefully. But certainly our stance is that if we've, where we have to put measures in place that have impacted upon business, then there does need to be the right financial support in place. And I know there's been one or two feedbacks that we've had about the measures. We did put some, we thought, better measures in place when the circuit break was announced. I know we're getting some feedback on that. We're actually meeting with hospitality on Monday, and so we'll take account of that feedback, and then if the schemes do need to be improved, then we will do that. But, we're very clear this is unprecedented times, and we do need to give that support as much as we possibly can.
Okay.
Second
question really is, I suppose, to Dr. Muscat. Now, you've said that there's no biological evidence that there's no biological proof that the UK variant is here. But you've mentioned this South African variant, which you say may not respond to the vaccine. So how worried should we be about that?
We're not sure yet whether, how effective the current vaccine will be against the South African variant. People are looking at it, and until they come back to us about that, we can't be sure. But it's sensible to be more cautious with the South African variant than with the UK variant until we know more about it, because of this question mark that is present over this variant. And that is one of the reasons why we need to be really careful with our borders.
So just as a supplementary to that then, your advice is that because the UK has effectively closed its borders, that anyone from Jersey who's looking to travel, unless it's essential, they shouldn't?
My advice is that people should think carefully before travelling and determine whether, in fact, their travel is really important and essential. Obviously, in some instances, it certainly is, for example, medical purposes. And it is also important for us to maintain a very strong sort of testing system in relation to anyone coming into the island, however transiently they have been abroad. So the red rating, so to speak, of isolating till you have negative results from tests on day 0, 5 and 10 is vital, and we need to continue to maintain that for as long as it is necessary to do so.
All right, thank you. And so just to clarify about this South African variant, how worried should we be about that then? Because if there is no guarantee that the vaccine's going to be effective against it, we could find ourselves back to step one.
Which is why we need to be careful. But as I've emphasised earlier on, people are looking at whether the changes in the South African variant will allow it to evade the protection afforded by the vaccine, and if so, by how much? Because it is not an on or off type button. It is usually a matter of efficacy being gradually eroded. All that has yet to be worked out. So, if you like, people looked at the structures and thought, maybe there may be lower efficacy from the vaccine against this. Let us test this out in a test tube, so to speak. And that is what they're doing. The reason I mention it is not to scaremonger, but to actually emphasize the importance of being very careful at the borders. And it's also reasonable to say at this point that this isn't going to be the only variant that's going to arise and that's going to raise concern. We've had 2 variants in rapid succession. Mutations happen all the time. The vast majority of the mutations are of no consequence, but ever so often, some of them are, as has just happened. So we've just got to be careful. And the people making vaccines are also being careful and are also adjusting their systems to allow them to expand on the number of variants that the vaccines cover going forward.
Right. Thank you.
Okay. Right, I think on the basis of where we are on the time, we'll start drawing things to a close, but thank you, everybody. Can I just thank you online for taking the time to listen. We really are in a better place than we were before Christmas because of the actions we've taken as a government and as a community, and because of the ongoing success of the vaccination programme. Now, we're taking a cautious, but it is a pragmatic approach over the coming 2 weeks, and as we move into the stages beyond. But it is an approach that I really believe will serve us well. So I share the hopes and wishes of all islanders that we will all be together again this year, in comfort, in safety, able to enjoy the summer and the rest of 2021 as a community. But thank you very much for listening tonight, and we'll draw this conference to a close. Thank you very much.